So we're going to be talking about semaglutide and NAION, which is non-arteritic anterior ischemic optic neuropathy. So, of course, the reason you're using the semaglutide, which is a glucagon-like peptide, number one, analog, is to lose weight. And there are a number of mechanisms by which the semaglutide allows you to lose weight that are based on the normal glucagon. So we'd like to have better insulin interactions with your blood sugar. We'd like to have suppression of central nervous system and to get satiety earlier. We'd like to have gut motility to hold the food in there so that you don't eat too much. And so there's lots of reasons why semaglutide is going to be helpful for patients who have diabetes or obese to improve their long-term outcomes for major adverse cardiovascular events and presumably also non-arteritic anterior ischemic optic neuropathy. So it's a little bit of a surprise that semaglutide use would be associated in any way with an increase of non-arteritic anterior ischemic optic neuropathy. So when we're confronted with an association like this, we're trying to determine, is it a causal association? Because a lot of things are associated, but not causally associated. And that is the question that has not been answered in the studies that have been looking at this to date. We know that from the studies that there is an association. However, it could be A causes B and A causes C. And so A might be diabetes. Diabetes causes you to be obese. Obesity causes you to need the semaglutide weight loss agent. But diabetes also causes NAION. So controlling for that confounding variable, that there might be a unifying mechanism, is a difficult thing to do in retrospective studies, which is all that's been done today. In addition, there has to be a biologically plausible mechanism by which this would occur. This is supposed to be reducing your chance of NAION, not increasing your chance. And one of the interesting things about diabetic control for the eye is we know that overly vigorous control of the blood sugar levels can actually worsen transiently the retinopathy of diabetes. So there is analogy. Analogy means the mechanism has been shown with the same class of agent or with the same effect to produce the paradoxical effect. So we know that tighter control of glucose from a number of mechanisms, whether that's blood-brain barrier or blood-retinal barrier or endothelial control, or whatever the actual mechanism is, that empirically you can get worsening diabetic retinopathy from tighter control. So this whole concept of a paradoxical but biologically plausible mechanism does exist for semaglutide and NAION. The second is you have to have a close temporal relationship between the cause and effect that is coherent with the pharmacokinetics of the agent. So if there's a mechanism of ischemia from drug, from a certain type of hypersensitivity reaction, like a type 1, you would expect it to happen right away. Or if it's antibody mediated, it would take some time for the antibody to build up. But it's probably not a hypersensitivity or an allergic reaction. This is probably something to do with the metabolic control, if this is a true association and it's causal. The third thing is we have to have class effect. All the agents in the same class have to produce the same thing, and that's yet to be shown in the semaglutide associated studies, whether it's got a class effect. And the effect has to be specific. So non-arteritic anterior ischemic optic neuropathy is not very specific. There are clearly some drugs that cause a very specific side effect. Like if you took certain drugs, you might get Stevens-Johnson syndrome. That's a very specific effect. But NAION is not a very specific effect. For example, in ophthalmology, hydroxychloroquine causes a bullseye maculopathy. Well, there's just not that many things that can cause a bullseye maculopathy, and you can't describe that to chance alone. But NAION in a diabetic who's on a weight loss drug, there are so many other confounding variables that could be producing that NAION. It's going to be very difficult to ascribe specificity of effect. The other thing that we need is dose response curve. The more you take, the more likely you are to get it. And that was not looked at in these studies. There's no apparent dose response curve here. And then finally, de-challenge, re-challenge. De-challenge, you take away the drug and they get better. Re-challenge, you give it to them and they get it again. Most patients are not going to accept a re-challenge for NAION if they think it's the agent. So even though there's been a lot of press lately, and probably this video is going to have to change over time because this is all new stuff, there is probably an association, but that association does not prove causation. I think there is a biologically plausible, analogous potential mechanism for this to be the case. I think there are confounding variables. The effect isn't very specific. It looks like garden variety NAION. There doesn't seem to be any dose response curve. There's no D-challenge, re-challenge data yet. And the temporal relationship between the cause and effect has not been precisely defined, and therefore we cannot assess the coherence with the pharmacokinetics of this agent to prove that the biologically plausible mechanism, tightening control, what makes you worse, is the actual pathogenic mechanism. And so until we have all of those pieces of information, it remains unclear what is the relationship of semaglutide and NAION, and association is not causation.